Will having prostate cancer end sex in my relationship? Prostate cancer will invade your entire life. 1 in 6 men in the world will suffer from it before they die. 50% of those will have problems with ED. You may have to learn how to deal with ED. This is not the end of your life but a new beginning. Sex is more than having your phallus serviced. Your failure to look after your partner during your recovery time could make you the X in sex. Stay with me, and you will learn how this can happen. Your partner will also miss the closeness and relaxation sex brings to a relationship. It will bring caring couples more together as they learn how to make more of the life you have now. You will realize very quickly how testosterone suppression therapy will knock out the connection between the brain and the phallus. Some of you will think that to solve the problem you simply want to find another source of testosterone, or a testosterone stimulate. Wrong. The problem is that prostate cancer needs testosterone to grow and thrive. You need to make a choice, to live or die. If you want to live, please read more. Let's start at the beginning. Your phallus is a muscle, and if you have ever had a broken leg or arm, you know when it is not used it will atrophy or shrink and lose its strength. The question becomes, how do I keep it functionable when there is little or no response? As soon as you are feeling well enough, like 1 week following your procedure, you will need to start on either Viagra or Cialis at least twice a week to keep some stimulus in your phallus. If you are on any of the testosterone suppression drugs, you most likely will not feel like sex. In fact, you may feel very crappy, but you still have a responsibility to look after your partner and to try and work with your phallus. Not sexually, but putting it into a phallus vacuum cylinder with a pump attached. Or having a partner willing to spend a lot of time caressing and loving your phallus. This may be aided with Viagra or Cialis at least twice a week to keep the phallus from scaring internally as long as you get a response. Injections are the next choice if you fail to respond to all the other types of stimulation. These also should be done at least twice a week, and you should always alternate the side of the phallus, giving only at the 10 and 2 o'clock positions. The point is not to have sex until you're healed and feeling good again, but to keep your phallus fit and able. Sex will be different for you now, as you are likely not to have much feeling in your phallus, but you will have a climax of sorts after some time. It is now your responsibility to look after your partner to make them and their experience as good as possible. It is time to start really enjoying your time together. Please subscribe to our channel, learn more, ask questions. We hope this helps you. Ellen and Michael Moriarty, 2 RNs.